Let me bring you this now. KZN emergency services personnel want to save lives, but now they fear for their own. Paramedics have been robbed, assaulted, and even shot at in the line of duty. While the attacks have slowed down response time, as many are now reluctant to respond to some areas. eNCA'S Lethiwe Mdluli is talking to paramedics in and around Durban regarding this concerning issue, and she joins us now, of course, to give us some clarity and context. Lethiwe, good morning to your colleague. I mean, this is quite concerning to know that those we rely on, especially when it comes to emergency services, they in turn are targeted. What are paramedics saying about, putting their lives on the line to save lives, while in turn they seem to be targeted?
Tumelo, I think it's very important to mention that it's not only emergency services that are actually faced with this issue. It's also just the healthcare workers overall in the province. I've been engaging with unions this morning, speaking to them about some of the incidents that they've heard from the workers at these health facilities, and they are saying that they've heard quite a lot of incidents and they are not happy with them. It's more especially happening in rural areas, but also in townships as well. There are some areas that are considered hotspots, and I will be engaging with emergency personnel just a bit later on. Right now I'm actually joined by DINOSA who speak for nurses across the country. I want to bring in the provincial chairperson for DINOSA, Cele. Mr. Cele, thank you so much for joining us. I know that you engage with your members all the time regarding safety issues. Take us through what you've heard so far from them in terms of not feeling safe where they work.
Thank you to you and your viewers. We've heard and seen incidences happening inside and outside of health facilities. We are very much disturbed most of the time because it's either our members and employees of the department are exposed to dangerous situations whereby at times they lose their possessions, like in the case of one district which is usually troubled with hijackings of government vehicles. I'm talking about King Cejwayo district, whereby our members who are nurses, most of the time they will lose their cell phones, monies, and all their personal belongings. And we've always raised that with the department, and most of the time you find that they are also hands are tied at the back. It's not like there's much that they will do in such cases.
And I'm sure in these health facilities, there are securities at those health facilities, but unfortunately they can't act because of some of the issues that they deal with on their own as well.
Yes, we have seen that there is a little bit of lack of proper training for securities, because we believe that if you are a guard and you are guarding a health facility, is not exactly the same as a normal or other workplaces who are not necessarily dealing with patients and the public in big numbers like a hospital. So at times you will see incidences that show that there's a lack of training in dealing with the situation, and at times you will see that they also not very well empowered to deal with such situations, especially where people who are coming into the facility are armed, and you find that most of the guards are not armed. So that exposes the nurses that are in that facility, whether it's a clinic or it's a hospital.
And just quickly, Mr. Cele, what do you think the government needs to do, the Department of Health needs to do? Do you think that there are enough interventions to protect healthcare workers and also emergency personnel?
In some instances, you find that the guards themselves, there's a shortage. So we would want to see increase the number of guards that are guarding these facilities. In some instances, we have raised a call to say, can they be armed? Because people who force their entry into these facilities, they are armed most of the time, and they are not capacitated to deal with that situation. Or at times we've asked that they must also involve SAPS to do regular patrols around hotspots.
Thank you so much.
Thank you.
Well, Tumelo, there you have it from DINOSA. They represent healthcare workers such as nurses, and they are saying that they are wanting for the government or the Department of Health to maybe arm some of the security guards in these healthcare facilities. They did mention that there are areas where there are many issues in regards to safety. Also, we do know here in Durban, one of the hotspot areas that healthcare workers or emergency personnel do not really like going, but they are forced to because they have to help those people that need the help, are places such as Umlazi and also Inanda. I know in Umlazi some of the vehicles such as ambulances have been hijacked, and in Inanda we've heard of a healthcare facility being or criminals targeting a healthcare facility. So these are some of the issues that healthcare workers are dealing with, but unfortunately because of the job that they're doing, they have to be there and continue on working. But of course unions are also saying that the department needs to come through and try to find ways to prevent some of these crimes that are taking place inside these facilities, to stop basically.
Yeah, this is so disheartening to hear, Lethu, to say the very least, to know that there are, vulnerable patients that need healthcare services and healthcare workers still willing to assist if it means putting their lives on the line. Yet criminals are so brazen lately, walking into these communities and, destructing, of course, the work that the healthcare workers are doing. But of course, DINOSA being one of those unions speaking against it, saying the department needs to come on board, assist the police department as well, having to come and assist in terms of crime prevention in these facilities. But some of these crime-ridden areas, which quite frankly is everywhere in South Africa, hopefully something will be done to attend to this matter in a sense of urgency. That's my colleague Lethu out in Durban for us.